Hello, my name is Adam Rosen. I'm an orthopedic surgeon who specializes in knee replacement. I created this video for my patients so after I talk to them and see them in the office, if they have questions they can re-review what I've talked to them about, or they may share this video with friends or family members so they may better understand what they're looking at as far as what a knee replacement is and what a knee replacement entails. So for knee replacement, this is a surgical treatment that we do commonly for severe knee arthritis. Prior to you having surgery, there's a number of treatment options that you might try. Things such as diet, exercise, the use of over-the-counter oral medications or pills, injections, braces, and topical agents. These are all things that people have used to try to treat the symptoms of arthritis. If those things fail, and you have severe arthritis, you may be a candidate for knee replacement. So what is a knee replacement? A knee replacement is something that I like to refer to as more of a knee resurfacing. So this is a knee model, and I believe a lot of people think when we talk about knee replacement that we chop off the end of the thigh bone and the top of the shin bone and we place a hinge inside the knee. And we do have implants like that, but they are typically used for people with fractures that are not fixable or people with tumors. A knee replacement more typically is something like this, a resurfacing of the ends of the bone where the cartilage has been damaged from arthritis. So a typical knee replacement involves a shin bone part. There's a device that we use to flatten or plane the top of the shin bone, and then on top of that goes a metal plate. Inside the metal plate goes the plastic insert, and the plastic insert essentially functions as your cartilage and meniscus. This is the structure that can wear out over time, similar to a brake pad inside a knee. The second part of the operation is the end of the thigh bone, or the end of the femur. This component is shaped like the letter C. We have a device and make a cut on the end of the thigh bone. There's an additional cut made on the front and the back of the thigh bone, and these angled cuts called chamfers, and this piece also gets cemented in place typically. And this is the majority of the knee replacement, which now allows you to straighten and bend the knee. Your ligaments are those ropes, and as long as the ligaments are okay, they're left intact. In people where those ligaments are damaged, we have specialized implants that may make up for those ligaments when they're not functional. The third part of the operation is the kneecap. This is a kneecap button, and what this does is it gets cemented on the back side of the kneecap. Your kneecap is important because the tendons attach to the top and the bottom of the kneecap, and that's what allows your knee to straighten and bend. So when you touch your knee from the outside after a knee replacement, you will be touching your own bone. But on the inside or back side of the kneecap, we cap that with a piece of plastic which also gets cemented in place, and this allows the plastic to rub on the metal when you bend and straighten your knee. Once this is done, everything gets closed in a series of layers and stitches and staples, and following that, you'd be taken to the recovery room. Shortly after that, you'd be taken upstairs, and the plan is that afternoon you will do physical therapy, starting with your bending and straightening exercises. You may stand and walk with a physical therapist. Because the cement that we use is hard and set up within 10 minutes, it's ready for you to put full weight on it the day of the operation. I hope that you find this information helpful. If you have further questions and you're one of my patients, I will see you back in the office to discuss further. If you've found this video and you're somewhere else, please contact your orthopedic surgeon to find out whether or not you are a candidate and what specific indications and risks may be involved in your surgery.